Myself, Ms.T. Darthi Tamilmozhi, M.Sc Nursing, Medical Surgical Nursing Department from ES College of Nursing. So now I am going to deal the topic regarding angina pectoris. So definition of angina pectoris, it is chest pain resulting from inadequate blood supply to the myocardium. Or angina pectoris is a clinical syndrome usually which is characterized by episodes or paroxysms of pain or pressure in the anterior chest. The cause is usually insufficient coronary blood flow. So this is angina pectoris. Once the arteries got only less amount of oxygenation supply, the area got under pain. So in both chronic angina and unstable angina, your heart does not get the oxygen which is needed. So the etiological factors to develop angina pectoris is atherosclerosis. So atherosclerosis is hardening and thickening of the arteries. So it is having the restriction of insufficient oxygenation supply to the myocardial muscles. And second risk factors is physical exertion. During our physical exercises, the patients may experience angina pectoris, that means chest pain. And the third one is stress. If the patient is having any high level of stress, so it may also develop angina pectoris. Then eating heavy meals, so it is also one among the etiological factors to develop angina pectoris. And factors in blood supply, one is coronary vessel disorder and second one is circulatory disorder. And third one is blood disorders, and fourth one is exercises, and fifth one is emotion. Then the types of angina, there are three types are there. One thing is stable angina, and stable angina means it is predictable and consistent pain. So it is occurs on during our exercises or exertion. So it is relieved by our rest period. So it is called a stable angina. And unstable angina are crescendo or pre-infarction angina. So it is having the symptoms of occur more frequently and last longer than the stable angina. The threshold for pain may occur at rest period. And variant angina occurs at rest, and because it is having the spasms of coronary artery. Once the coronary artery get any narrowing, so it will create the pain at rest. So it with reversible ST segment elevation. And pathophysiology of angina pectoris, so due to the etiological factors which was discussed above, so due to that the decreased blood supply to our myocardial muscles and decreased oxygenation supply and glucose level. Then after that the reduced pumping mechanism will be there for the patient, and at last anaerobic mechanism will be taken place. So anaerobic mechanism means so all the metabolism which is used only the glucose and glycogen. So in aerobic mechanism means it will metabolized with the use of breakdown of the fat and proteins. But here anaerobic mechanism will be taken place. So the increased lactic acid level, and at last the patients may go under pain. Then clinical manifestations, chest pain, the compression in nature and present over the pericardium and aggravated by the exercises and relieved by the rest. Commonly associated with sweating and radiates upper limb, neck and jaw. Sometimes it radiates epigastric region also. And here the patient may feel tightness or a heavy choking or strangling sensation. Then feeling of weakness or numbness in the arms, wrist and hands may accompany the pain, and diaphoresis and dizziness. Patients may experience excessive level of sweatings also. Then patients may experience this giddiness. And patients may accompany with the shortness of breath and difficulty in breathing because of lack of oxygenation supply. Then tachycardia, increased heart rate. Next, we will move on to see about the assessment of angina. So due to that angina assessment, we have to keep it one mnemonic word, PQ or ST. The P indicate position and location and provocation. So position of the pain and location and provocation of the pain. Then Q means quality, quantity of the pain. And or the radiation and relief of the pain, where and all the pain was spreading. Then S severity, how the pain is. So how much severe the pain was. And then symptoms also. Then T indicates timing, how long the patients may experiencing of the pain. Diagnostic evaluations through history collection and then ECG. In ECG, reversible ST segment elevation or depression and T wave inversion we can find out. And treadmill test or stress ECG. Then next one is radionucleotide scanning. So we come to know where the problem is and where the thrombotic formations and where the artery got blocked. Enzyme studies. C-reactive protein, it is a marker for inflammations of vascular endothelium. And next one is coronary angiogram. We can find where the problems occupied. And next one is cardiac catheterization. So through this kind of the diagnostic evaluation, we can diagnose whether the patient is affected with angina pectoris. Then management of angina pectoris is medical management. First one is beta adrenergic blockers, example propranolol. And second one is calcium channel blockers, example nifedipine. Then third one is antiplatelets, example aspirin and clopidogrel. And fourth one is anticoagulants, example heparin. Management, so you have to keep it this monarch. Then A, B, C, D, E. This mnemonic word you have to follow that. A1 is aspirin and B is beta blocker and C is cigarettes and D is diet and E is education regarding the angina pectoris prevention and treatment. So in surgical management, first one is revascularization procedures. So through this revascularization procedures, we can restore the blood supply to the myocardial muscles. So if we prevent that, automatically the patients may have or the patients may relieved from pain. So here what is happening? So inside the catheter, all the things will be inside the catheter. It will go inside the arteries and widen the arteries, and the blockage will be relieved in that particular areas. Then PTCA, percutaneous transluminal coronary angiography. So here obstructions will be located through the guide wire and removed, leaving the guide wire in the particular area. Then balloon catheter is pushed over the guide wire and center over the blockage. So the balloon is inflated, it will open the narrowed arteries. So obstruction locations will be identified and it will relieved by the guide wire. Then nursing management, treat associated symptoms, morphine sulfate, oxygenation administration and nitroglycerin, aspirin, reduce anxiety and prevent pain. Nursing diagnosis, ineffective myocardial tissue perfusion secondary to the coronary artery disease as evidenced by chest pain or equivalent symptoms. Anxiety related to fear of death, deficient knowledge about the underlying diseases and methods for avoiding complications. Non-compliance, ineffective management of therapeutic regimen which is related to failure to accept necessary lifestyle changes. So till now we have seen regarding angina pectoris, risk factors and pathophysiology to develop angina pectoris and what are the treatments which is needed with the affected patients of angina pectoris. Thank you.